In March of 2020, the Trudeau government closed Canada's borders to foreign nationals. This was just the first in a series of draconian impositions on the liberties of Canadians by the political class. Lockdowns, stay at home orders, mandatory masking, and vaccine coercion followed shortly. Freedom of travel was greatly restricted, and mandatory quarantine facilities were established in hotels across the country. Aside from these public health measures, the Canadian government also took a wide range of economic steps. They There was widespread mandated business closures, which were followed by $200 billion in wage subsidies and other support to businesses. Through enhanced EI, CERB, CRB, enhanced child tax credit, and enhanced OAS, another $100 billion was doled out to individuals. And yet, it turns out the coronavirus wasn't much of a threat after all. It was only life threatening to the elderly or people who were middle aged with severe health complications. For young people, the health risk was minimal. So, why not have at risk people isolate themselves and let everybody else go about their lives? And indeed, that's what a number of areas did. The reality is, the political elite in Canada wanted to test their powers and to see how far they could go into medical fascism before the population started to push back. And it's scary how complacent and obedient Canadians were, despite health orders that were not based on science or best practices, but were simply performative. The only reason the restrictions were finally lifted was because of the trucker convoy protests, which stated flatly, we're not going to take it anymore. Now, some could argue that lockdowns and other measures were essential because otherwise Corona would have overwhelmed the hospitals. And there is an element of truth to this, because Canada has socialized medical insurance, and our system is not very adaptive to sudden changes in conditions. All of the prices are set by the state, and medical care is rationed. A sudden surge in demand would absolutely cause huge problems for our socialized medical system. In fact, even under normal conditions, thousands of Canadians die every year waiting for medical treatment. But we shouldn't allow the inadequacies of socialized medicine to be used as justification for further encroachment of our liberties, especially not when there's a better solution, namely having a free market in healthcare. A free market would make responsive changes, would be responsive to sudden changes in market conditions and be able to use the price system to handle sudden swings in demand. Some countries didn't really lock down at all. Sweden stayed open while other countries were shutting everything down. Instead of making public health measures mandatory, Swedish authorities simply had recommendations for remote work, social distancing, and curtailment of non essential travel. They chose voluntary measures instead of compulsory ones. Schools, shopping centers, gyms, indeed, most businesses remained open, although there were some restrictions on how many people could gather in one place at one time. As a result, Sweden had some of the lowest excess mortality rates in all of Europe.